and we are thrilled that Sahajanand Medical Technologies has chosen Hyderabad as the destination to set up Asia's largest stent manufacturing facility. Hyderabad also serves as an important hub for companies like Medtronics to carry out their innovation, development and engineering activities. In line with our commitment to the medical devices sector, we have increased the focus on med devices and health tech as part of this year's BioAsia program. On February 19th, and I do hope, we meet many medtech leaders on February 19th and deliberate on the opportunities that are presented in this sector. Our largest initiative under the GRID program is Hyderabad Pharmacity. Pharmacity is one of our flagship initiatives of the Government of Telangana to create a global benchmark for sustainable industrial cities. When launched, Hyderabad Pharmacity will be the world's largest pharma cluster, and I would be inviting all of you and many of you, in fact, for the launch of this program, later part of this year. We understand that the industry, especially the pharma industry, is on the cusp of change due to several factors, including price erosion, cost pressures, etc. This change, while posing a huge challenge to the industry, is also opening new opportunities. Aging population, increasing chronic illness, and demand for personalized healthcare is setting the ball rolling for the industry. Certainly the business models are changing and disruptions are happening in a big way. Especially the convergence of information technology and healthcare and life sciences is an exciting opportunity for the entire industry. Government of Telangana has recognized these headwinds of change, and through Pharmacity, we invite the industry to leverage the opportunities to develop affordable and innovative solutions for tomorrow's problems. I'm happy to report that all the planning works to establishing Hyderabad Pharmacity are completed, and also the statutory clearances, including environmental clearance, which according to me is a major milestone, are in place. Government of India has also recognized the potential of Pharmacity by according the status of National Investment and Manufacturing Zone. We are very close to land allotments to various industrial investors. Another area that I personally believe is poised to transform the healthcare sector is the digital medicine space. And Hyderabad is well positioned to contribute to the global efforts with its extraordinary strength in technology and also life sciences. We are happy that Hyderabad is already serving as a global hub for Novartis in their digital aspirations, in addition to their global development operations. With more than 5,000 employees in their digital operations, in addition to about 500 employees in drug development operations, Hyderabad has emerged as an important site for Novartis. My good friend and the CEO of Novartis, Vaz Narasimhan, will be joining us at BioAsia tomorrow, and we are truly excited about this partnership with Novartis. Companies like Sanofi and many others are also expanding their R&D support and digital footprint in Hyderabad. I'm happy that London School of Hygiene and Tropical Medicine has also chosen Hyderabad to set up their India outpost, and this center would also have a significant focus on data and analytics in addition to clinical research. I would like to thank my dear friend Peter, who has promised to make Hyderabad an important global hub for public health research. Under the Life Sciences Grid again, initiatives are progressing well. We have facilitated industry-focused training programs for upskilling our workforce. We had launched a pilot program of vaccine skill development last year during BioAsia. And the most important aspect of this training program was that it was developed and delivered by the industry itself. We have also partnered with United States Pharmacopoeia on a skilling program focused on data and quality standards. Based on the feedback from the industry and students, we are constantly making improvements to skilling programs with the commitment to scale up and also launch a new training program around areas like analytical chemistry, AI, ML in healthcare, particularly training for clinical data scientists, biological characterization, and manufacturing, among many others. We had earlier announced establishment of a B Hub, a biotech hub, which will be the first of its kind scale-up manufacturing facility at the Genome Valley. I'm happy to report that the Department of Biotechnology, Government of India, has agreed to partner with Government of Telangana in this endeavor, duly recognizing the potential of this facility to accelerate biopharma growth in the country. The project will be grounded in the next 2 months and will feature a growth phase park, 200L single-use scale-up manufacturing facility, and also training as part of its mandate. I think that goes back to what Kiran was saying about the potential for biopharma in our country. BioAsia has also played an important role in the journey of the state and the journey of this city. It is the single largest platform for life sciences industry, and we are very proud to host it year after year. BioAsia has helped us get recognized at a global level and has connected us to the global ecosystem, which is crucial for us to support our vision for the industry. Switzerland, as I said, one of my favorite countries, is our partner country for BioAsia 2020. Home to a globally unique life sciences cluster, Switzerland has a dense network of pharma, medtech, biotech, and nanotech companies. Through our partnership, we hope to derive mutually collaborative outcomes and explore new opportunities which are mutually beneficial. We acknowledge that the world is changing. Technology is leading the change. BioAsia 2020 is therefore aptly themed around today for tomorrow. As the theme indicates, BioAsia 2020 will explore the capabilities that life sciences companies should invest in today to thrive and create value tomorrow. In my view, any solution for tomorrow cannot be developed without focusing on innovation. What I call the 3I mantra for success: innovation, infrastructure, and inclusive growth. We have, by and large, taken care of the infrastructure. There is a need to accelerate innovation and also promote inclusive growth in our startup culture within the industry. We recognize that medicine is moving from pills to cells and blockbusters to niche busters. In line with the theme of this year's BioAsia, we at Government of Telangana are also committed to building capabilities of tomorrow and are planning to establish a world-class institution focused on curative therapies in Hyderabad. The institute will be engaged in affordable development and commercialization of the new age curative therapies, particularly cell and gene therapies, for diseases pertinent to India and also other emerging developing countries. We have partnered with the Center for Cellular and Molecular Biology, CCMB, which is a premier research and development institution in this effort. I'm delighted that we have the opportunity to host Dr. Carl June, who is a pioneer in the area of CAR T therapy, with us today, and also recognize his remarkable contribution to the industry. I would also like to seek his kind support and patronage to our vision in setting up this wonderful institute and taking it further. I take this opportunity to congratulate my team, particularly our Director Life Sciences and CEO of BioAsia, Shakti Nagappan, my Principal Secretary Jayesh Ranjan, the partners and the sponsors for having diligently crafted this year's program, to have informed and deep conversations around healthcare, new technologies, data and analytics, and other topics of industry relevance. I hope you'll have a productive time over the next 2 days at this event and enjoy the lovely hospitality of our wonderful city, Hyderabad. Thank you very much.
Thank you very much, sir. It's always a pleasure to hear from you. There's so much to look forward to and share. Thank you for sharing all of that. The reason that state has been able to open its arms to opportunities and collaborations is because it's backed by individuals like you. So thank you to you and your entire team for the same. Ladies and gentlemen, a surprise announcement that I'd like to make. We're extremely delighted to share that along with other incredible keynote speakers like Dr. Carl June and Dr. Peter Pyatt, we'll get to hear them in detail tomorrow, sharing their expertise and knowledge with all of us. We will also be joined by Dr. Siddhartha Mukherjee, an Indian-American oncologist and Pulitzer Prize-winning author. He will be joining us tomorrow, sharing with us his vision to bring innovation CAR T cell therapy to cancer patients in India at 1/10 of the global cost. We're positive that this is a session that you would not like to miss. Moving ahead, I now request Professor Redana, Executive President, FABA and School of Life Sciences, University of Hyderabad, to give us closing remarks and propose the vote of thanks.
So, Honorable Minister for Industries, Sri KTR, His Excellency the Ambassador and Head of Mission, Mr. Andrews Baum, Embassy of Switzerland, Dr. Carl June from University of Pennsylvania, the pioneer in CAR-T therapy and Genome Valley Excellence Awardee, and other dignitaries on the dais, distinguished invitees, delegates, ladies and gentlemen. It gives me immense pleasure to propose formal vote of thanks on behalf of the Federation of Asian Biotech Associations and on behalf of the Government of Telangana. And special thanks to Mrs. Kiran Mazumdar Shah for launching the Hyderabad facility, and Dr. Peter Piat, Director of London School of Hygiene, for launching the London School of Hygiene and Tropical Medicine Outpost in Hyderabad, and Dr. Carl June for accepting the Genome Valley Excellence Award, and all of them, I thank you profusely, one and all. And the Federation of Asian Biotech Association, which started BioAsia in 2003, today has grown into a global event, one of the major global biopartnership events. And our thanks goes to Dr. Bajaz, Mr. B.P. Acharya, Dr. Balasubramaniam, and Mr. J.S. Ranjan, Shakti Nagappan, and many others, and specifically the role of Ajit Shetty in the technical program. It has grown to this level. So I thank all of them profusely and thank one and all. I hope and wish that the global industry leaders, academicians, policymakers, innovators, investors assembled here will deliberate in the next 2 days and adapt novel business models today for addressing the challenges tomorrow. Thank you, one and all.